coronavirus update. Today you'll hear from County Health Administrator Miranda Hawker, as well as County Administrator Jason Brown, who will provide a local update to the local response to coronavirus in Indian River County. After they give their presentations, then they will be available for questions. Miranda?
Thanks so much, Brian, and I appreciate all of you being here today. I did want to talk about some statistics. We've broken that 1,000 marker a couple days ago. We're at 1,112 cases, 79 COVID hospitalizations, and that is an ever hospitalized number. In terms of current hospitalizations, we are at 26 current hospitalizations. 8 of those are in the ICU, and 5 of these are on vents. This week we have 112 cases in long-term care facilities, and we have a total this week of 20 deaths, 11 of these in long-term care facilities. And I remain very concerned about the significant increases we're seeing. It's vitally important for everyone to wear face masks in public. In terms of the state rate, we're at 244,151 cases, 17,602 hospitalizations, and 4,102 deaths. In terms of total testing that's occurred in our county, we have a total testing number of 17,551. 1,112 of those are positive, 16,431 are negative, 31 are pending, and 8 are inconclusive. In terms of our cases, age range is from 0 to 99, a median of 38 years. The health department this past week has tested 234 clients, and for a total of 1,362 year to date. So this is by our residents, and I'm going to break this out between these two slides. But that black line that you see, and this is year to date to yesterday, which is our most recent data, and you can see that black line undulate, and then it's continued to go up, and we're at 10%. And this week isn't over yet. So there you can really see that positivity curve and how our percent positive has fluctuated and how we continue to increase, and we surpassed what we were early in this pandemic. So these are our COVID-19 confirmed cases, and you can see the stay-at-home order, the decrease, the stay-at-home were lifted, and now our increase. And our cases and our percent positive is not going down. That number continues to go up. You're seeing the peaks around the increase right there on the epi curve in terms of confirmed cases. I really thought that, and actually let me go back a second. I did want to talk a little bit about last week. The city of Vero Beach had 464 cases. Now on 7/10, they're at 701 cases. Last week, the city of Sebastian was at 65 cases. And this week, they're at 107. Fellsmere last week was at 192, and this week we're at 243. So in each of our major cities within our county, we are continuing to see that same trend. I did pull out these cases in long-term care facilities. I know that we've had a number of our cases most recently in a younger population is that age range is, the median age is now 38. But when you look at these cases in long-term care facilities from May 29th and how that continues to amplify and where we're at on July 10th is significant. And so even though we have a younger age demographic getting sicker, our younger age demographic, many of these people are working, and these people then are able to put their the people they're working with then at risk, who then could become infected. We all come in contact with our grandmothers. We come in contact with older adults each and every day. And it's so vitally important that we wear our masks to help contain the spread. In terms of our confirmed cases by age, and this shows you how that spreads out. So in terms of those 75 years and over, that's 11% of our cases. 55 to 74, that's 18% of our cases. 35 to 54 is 27% of our cases. 20 to 34 is 30% of our cases. 5 to 19 is 12% of our cases. And 0 to 4 is 2%. I wanted to talk a little bit about our deaths that we've had this week. It doesn't seem quite right to list them on the screen. And so I just called up that slide. We've had an 88-year-old male die. He was a long-term care facility resident. A 75-year-old female die. She was a long-term care facility resident. An 87-year-old female died in a long-term care facility. And a 24-year-old male died this week. I want to tell everyone, even though you think about COVID, maybe you just think about COVID affecting people who are older with underlying health conditions, and those are people who get very, very sick with COVID. People of any age with underlying health conditions can get very sick with COVID. But also people who don't have those underlying health conditions at a much lesser extent, but it still does happen that people can get very sick with COVID. So please wear your mask. Please socially distance. Please use your hand sanitizer and wash your hands if soap and water is available. And that's all I have. Thanks.
Thank you, Miranda. And next up is County Administrator Jason Brown. Jason?
All right, thank you, Brian. Good afternoon. 2 weeks ago today here, I announced that I had signed Emergency Order 2020-15, which required the use of face masks for employees of restaurants, retail, other public-facing facilities, and required the use of masks in county facilities and on the public transportation system. So that became effective June 29th, so we've had 2 weeks since that order was announced, and about 11 days since it became effective. Our goal with these orders has always been to educate and encourage members to wear face masks with encouragement as a last resort. I can tell you that this Tuesday at the County Commission meeting, the county will be considering a mask ordinance. This ordinance has two purposes. One is to clarify and reduce the penalty for violation of an order. So right now, these emergency orders are punishable by a second-degree misdemeanor. That is the only tool that is available to us under the emergency orders. However, we're proposing an emergency ordinance, which will allow the penalty to be a fine. We are proposing a $25 fine for the first offense, $50 for the second, and $100 for the third. Again, our intention is not to issue a bunch of fines, just as our intention was not to charge anyone and put people in jail over not wearing masks. To my knowledge, nobody to date has been arrested for such offense. This is the same authority that was in place for the safer at home orders. I don't recall folks being prosecuted. However, we wanted to be clear that we want to take that off the table as a concern. So, additionally, since that time period, I had two metrics that I was concerned about. One is the case data, which Miranda talked about, and as we all know, that number of cases has risen significantly over the last few weeks. For a while, the hospitalizations didn't seem to be rising as much. That has changed in the last couple of weeks. Of note, as Miranda said, we have 26 in the hospital today. The peak in April was 10 in the hospital at Cleveland Clinic. So following that, we had the downturn where the numbers were lower. A couple weeks ago, it raised back up to that 10, 12 level. And over the last week, we've risen from a high of about 12 or 13 to 26. So that's a very troubling trend indeed. The other metric that I've been looking at is mask wearing. So I would say that the number of people wearing masks has increased. Very happy about that. Still, it's far from universal. Would like to get that number to be a little bit higher, and as high as possible, actually. So for those reasons, the continued increases in cases, the precipitous increase in the number of hospitalizations that we're experiencing here, we're reading about that happening all over the state and all over the country, and we seem to be beginning to see that here as well. So for that reason, I will be recommending that the board approve an order requiring the public to wear masks in indoor facilities and all indoor public spaces where social distancing is not possible. Also in any outdoor spaces where there are more than 50 people assembled, where social distancing is not possible. If you think of a concert or a festival or some situation like that, farmers markets, those types of events, we would require those there as well. This ordinance, as proposed, would apply only to the unincorporated area, as the current one does. I will note Sebastian and Fellsmere have adopted similar orders to our existing emergency order. There, of course, would be exemptions for children under the age of 2, people who are observing social distancing in accordance with CDC guidelines, and persons who, for whom a face covering would create an impairment due to an underlying health condition. Also, persons that are working in a business where they can maintain social distancing or are not interacting with others would not have to do so. You would not, folks exercising while social distancing and eating or drinking would not be required to do so. And again, the intention here is to educate and encourage with enforcement as a last resort, and the enforcement now, instead of carrying that potential second-degree misdemeanor, would be the first offense would be a fine of $25, second $50, and third $100. So with that, I am recommending that to the Board of County Commissioners. I believe this is an important policy determination for them to make, but I do recommend that based on the experience that we have had and are continuing to see, because I believe this is the best way that we can do something to bend that curve, to stop this trend that we're on. We need to do something to reverse this course. If you look at the epi curve that Miranda had up there before, we had the safer at home order. We don't have that now. I think masks is a far less intrusive situation than stay at home orders. Those do tremendous damage to the economy. I know there's been a lot of concern expressed from some folks about whether government should do this. I see this as something kind of like speed limits. So we have speed limits because my actions need to not endanger other people. The same thing works with the face mask. My mask protects you, your mask protects me. So we've been encouraging the use of face masks, and that's always our goal in Indian River County. We don't want to to tell people they have to do something or make a regulation that requires them to do something unless we have to. And I believe, just like with speed limits, it wouldn't be safe for me to drive through downtown Vero Beach at 80 miles an hour. That's why there's a speed limit of 35 miles an hour. Because if I drive through there at 80 miles an hour, I may not harm anyone, but I very well may harm someone. So society has rules and laws to protect the general public from the actions of others. So for that reason, I believe that while this is not something that we like to do, and this is not something that we look forward to doing, at a certain point we need to make a stronger, we need to put a stronger requirement in place. And I believe that based on the experience that we are seeing today and the trend that we're on, that time has come. So that's all I have. I'll turn it back over to Brian. Thank you.
Thank you very much, Jason. And at this time, we'll entertain any questions that anybody may have.
So, Jason, I know that you mentioned, I'm just going to take this mask off like this. So, on Tuesday, when you recommend this emergency order on Tuesday at the county commission meeting, if it is approved by the board, when do you think it will go into effect?
As drafted, the ordinance would go into effect Thursday, if approved by the board.
Oh, at what time, Thursday?
It's 12:01.
Oh, okay, gotcha. Okay. And for the enforcement, it'll just be fines instead of jail time?
Yes, so this is taking that off the table. So what's available to us under emergency orders is only that second-degree misdemeanor as a penalty. So there have been some concerns expressed in numerous communities about the prospect of charging someone with a second-degree misdemeanor for a mask. So in order to accomplish a fine, we need to do an ordinance. So we're proposing the fines, so it's kind of like a speeding ticket or a parking ticket, and it's a non-criminal offense. That's what we believe that should be. Again, our intention here is not to issue a bunch of citations and fine people $25. Our intention is to have that as a tool so that we can educate and encourage folks to wear those masks.
It's not the same one that was passed 2 weeks ago?
Correct. So this would be actually an ordinance instead of an emergency order.
Oh,
Yes.
an ordinance, gotcha. Okay. Okay, all right, thanks.
Hi, I have a couple of questions. Not sure if it's for you or Miranda, but regarding the ordinance that you're proposing, is there a sunset time, or is it for a certain amount, a certain time frame, or is it just until you decide to?
It does not have a time frame on it. We could leave that in place until it's no longer needed, and then we can come back at any county commission meeting and remove that.
Okay. The other question I have is, do you expect these numbers to continue going up? At what point would you consider any new issues with the beaches being open last weekend? Do you think that that's going to cause another spike? And at what time would you expect those to show?
I'll talk to beaches and then let Miranda talk about the cases. I do want to say that we had a pretty good experience at the beaches over the 4th of July weekend. Our attendance was not heavy, was described to me by parks and ocean rescue staff as being like an average weekday on Sunday, and then like an average weekend on Friday and Saturday. So we did not have a huge amount of people at our beaches, and the good thing is that ensured that everyone was able to continue social distancing as they would do at the beach today, which is open today. And then if Miranda wants to add any more on the others.
So what I can say is, while I can't speculate about the beaches, I can tell you what evidence has proven is that any situation, whether it be wherever people are congregating, that those large events where people are congregating result in increased transmission. So we want to minimize we want to caution people against those large events, and I know Jason has spoken to that. What we would hope is any public health intervention, whether we had the stay-at-home order or now looking at this mask ordinance, depending what the county commission decides, those types of public decisions can have impacts on the public health. So wearing masks, there's a statistic out there from the Institute of Health Metrics from the University of Washington that they've looked at wearing masks universally can reduce transmission up to 50%, was that particular study that they did. But what we would hope that we would see with increased use of masks by our population is be able to slow down that increase in cases, that we can flatten that curve. I know all of you remember that we're talking about that a lot when we talked about stay-at-home orders. And so we're hoping that that has an impact on the increases that we see. And when we are looking at an action like wearing masks that results in less respiratory droplet spread, less possibility for people to inhale that into their lungs, you're in a much better place for reducing transmission.
And just to be clear, this ordinance, if it is approved, would not require mask wearing at the beaches or county parks or anything. Is that right?
Correct. The mask ordinance would primarily require masks at indoor public spaces. There is a provision for outdoor public spaces in gatherings of more than 50 where social distancing is not possible. The intention of that is not beaches. The intention of that is maybe like a festival or a concert or something like that, which I generally think is not a great idea right now anyway. However, if there were an event like that, then that would require the wearing of masks. But it's primarily we're focusing on indoor public spaces.
Okay, thank you.
Thank you, everyone. As always, you can stay up to date on all information from the county's local response to coronavirus at our county website, www.ircgov.com. And we would like to wish everyone a healthy and safe weekend.